Welcome to AI in Africa, where we discuss the intersection of technology, society, and the future of our continent. I'm Ada, and joining me today is public health advocate and researcher Tunde Akinwale. Tunde, welcome.
Thanks, Ada. Great to be here.
Today's topic is urgent: the healthcare brain drain in Nigeria. Over 5,600 Nigerian-trained doctors are currently practicing in the UK alone. That's not counting those in Canada, the US, Saudi Arabia, and elsewhere. Tunde, what's driving this exodus?
It's a mix of push and pull factors. On the push side, you've got poor working conditions, low pay, lack of medical infrastructure, insecurity, the list goes on. On the pull side, countries like the UK and Canada are offering better salaries, structured career paths, and safer environments.
So, it's not just about the money?
Not at all. Many doctors I've spoken to say it's about dignity. Imagine going through 6 years of intense training and then earning less than a fresh graduate in banking or tech. Then you work 48-hour shifts in hospitals with no electricity or gloves. It's demoralizing.
That's painful to hear. And yet our population is growing. Who's left to care for us?
That's the danger. Nigeria's doctor-to-patient ratio is already about 1 doctor to 5,000 patients. The WHO recommends 1 to 600. We're running a health system on fumes.
There was a viral clip recently, a government official saying we have enough doctors. What's your take on that?
Honestly, it shows a disconnect from reality. Saying we have enough doctors while our hospitals are overwhelmed is like saying we have enough food while people are starving.
So, what's the solution? Should we stop doctors from leaving?
You can't force people to stay. Instead, we need to make staying worth it. Improve working conditions, pay them fairly, invest in infrastructure, and crucially, create a system where healthcare workers are valued and protected.
I wonder, could AI help here? Like, if we automated certain systems, could it reduce the burden on the few health workers who remain?
AI can assist, definitely. Triage systems, diagnostic tools, telemedicine, but it's not a replacement for human care. AI should be a tool that empowers our doctors, not something we use to replace them because we've failed to retain them.
Well said. Before we wrap up, what's one thing you'd say to a medical student in Nigeria listening to this right now?
You are not alone. Your frustration is valid. But remember, this system needs you. And together, through advocacy, policy reform, and innovation, we can fix it.
Tunde, thank you so much for this conversation.
Thank you, Ada. Always a pleasure.
That